I'll be able to see them. Or?
No, you won't be able to see them.
Yeah. I won't be able to hear them. Is it?
No, but I will help you to record down all the questions. All the questions in
Mm.
appears here.
Mm-hmm. And how do I read?
Now we have only one, which is me. So we wait for a while. Yeah, okay.
This is for how long?
Ideally 20 minutes. Later, if
Oh, the mic wasn't on. We
Okay, sorry about the mic. Let's do this again. What I said just now. Yeah, welcome everybody who joined this webinar session. Um, Today we're going to talk about the career prospect in Masters in Public Health. So when you're logged in here, if you have any questions, you can just type it in the webinar question box. So how we're going to do this is that we will go through the entire presentation. Then whenever we get your questions, we will reply it after the entire presentation. Okay. So yeah, without further ado, let's welcome Professor.
Hi guys, again. Hi from Penang, warm and sunny today. You know which part of the world you are. I hope you're having a pleasant day and good weather. So, Masters in Public Health. What are the opportunities? What can you do with Masters in Public Health? Why you should do Masters in Public Health, or in some cases, why you shouldn't do Masters in Public Health? Well, as health goes, you may have individual health. That's what clinicians do. And what we do is public health. In some places, it's called community health. In some places, it's called social and preventive health. A rose by any other name is still a rose. So I would like to think that public health is a rose among all the other professions. So, what do public health professionals do? Well, most commonly in most countries, they are involved in the maternal child health. That means maternal health is mothers who are, even before they start, uh, what do you call, even before they're pregnant. We're talking about people who are planning pregnancy. So public health people are involved in that activity as well, in counseling, in advising, in screening programs. And then, of course, as soon as the woman gets pregnant, then we have antenatal care, which is again a lot of the activities is done by the mothers, by the public health people. And then you have mothers who have delivered the children. Again, the care of the mother after delivery, postnatal care, is also part of public health domain. And then the child itself, right from birth until the child grows up to adolescent, a lot of public health activity goes on there, inclusive of screening, inclusive of ensuring that the child is growing properly, and then ensuring that all the milestones are being met and on time. And also, importantly, is in the activities of vaccination. Now, what happens when the child grows up and becomes an adolescent? And then you have adolescent health. Again, public health is very actively involved in adolescent health. We're looking at, ensuring that they are counseled, that changes. I'm sure a lot of you all would have remembered how you changed when you became adolescents. Hormonal changes, your behavior you start changing, your characteristics. Health play. We know for a fact that this is the age, actually, adolescents when they start trying new things, which is a good thing, but unfortunately, at times it might not be the great of things. And you start smoking, experimenting with drugs, and unprotected sex. So again, there's a whole rule of public health people who play in ensuring that adolescent health is well cared for. And then, of course, you have elderly health. Again, elderly health screening, ensuring that they're protected, ensuring that they are empowered, ensuring that places where they are, do we have social and welfare for them? Again, public health personnel have a big role to play. Besides that, there's also very big in most developed and developing countries or industrial countries is occupational health. That again, a role of public health practitioners in occupational health. You have, of course, um, water, sanitation. This is again a very big role in most developing countries or underdeveloped countries where sanitation and water is such a challenging role. Again, public health people are in the core of things, very importantly, playing a role in preventing health promotion and education in these aspects. And you have communicable diseases. In most developing countries, communicable diseases are real challenges. We're talking about infectious diseases, zoonotic diseases, how to control them, how to evaluate what is the outbreaks and whatnot. Not only just becoming epidemiologists, but going more than epidemiology. We're talking about control of infectious diseases using health promotion, health education, standardized methods. This is again a role of public health practitioners. And you talk about non-communicable diseases, which unfortunately is no longer the domain of developed nations. We're talking about developing countries now burdened with infectious diseases, also have non-communicable diseases, cardiovascular problems, asthma, cancer is a major problem which needs to be controlled. In some countries, we have specific illnesses. We're talking about diseases like tuberculosis and HIV that need public health practitioners to help in control and to prevent these infections. In some countries, for example, in Malaysia, we in some parts of Malaysia, malaria is still endemic. Endemic means that it is prevalent, all year round. And dengue is a major issue because we have a lot of mosquitoes, and mosquito or vector-borne diseases is another issue which is of concern. So if you look at what I've just told you, so your aspects of diseases and your aspect of what public health practitioners do is vast and varied. I haven't even gone through nutrition as yet. So you can imagine how much opportunity that opens up. Traditionally, public health used to be done solely by medical doctors, but now I think, and it's very right, that non-medical doctors are beginning to take up this profession, which is true. And we have nutritionists doing public health. We have people with allied health professionals doing public health. We have physiotherapists doing public health. We have people with backgrounds in microbiology, biology, pure sciences who are doing public health. We have engineers who are doing masters in public health because water and sanitation is their field, environmental health is their field. We have people with environment background doing public health. We have medical as usual doing public health. So the reason why is that it makes you more marketable. It makes you more to give you plenty of job opportunities which are out there. You can be working for the United Nations, WHO, NGOs, your government services. It's just, the field is vast, and it gives you an opportunity to work internationally instead of just in your country. Well, no harm working in your country, but if you're young, I'm sure you want to explore the world before you go back home. So there's plenty and plenty of opportunities out there for you. Now, if what kind of masters in public health would you be interested in? Well, there are so many. There are masters in science in public health, there's masters in public health, masters in community health, masters in social and preventive health. They're all basically the same thing. But what is important is to have a reputable degree, a degree which will be recognized worldwide, which is what we are offering, a degree which is offered by the National University of Ireland, the course of which is from University College Dublin, which is a very reputable university in Europe. It is in Dublin. It's a beautiful big university, um, but what is the advantage of doing it in Malaysia rather than going to Dublin? I mean, if you can afford, you should go to Dublin and experience. It's a beautiful country with very nice people. But unfortunately, for a lot of people from developing countries, cost is a concern because, of course, living there and paying non-euro fees is a major impediment in doing courses in Europe, I guess, money. But in addition to that, what we offer in Penang is that you get the best of the one of the best education from island standards. But what you actually get is to practice in this country. So there's a lot of practical opportunities in Malaysia, problems which you will not find in a developed country like Ireland, for example, dengue, malaria, leptospirosis. So these are challenges which you would not find there, or different kinds of cultural and social aspects that you would find in developing countries, different kind of people. So I guess I would like to say is, doing your masters in public health in Penang, in RCSI UCD Malaysia campus, would be that you're getting an internationally recognized degree, and in addition to that, you're getting practical training that you would not be able to get in other places. So I would, I welcome you. If you have any inquiries, please do write in, or get back to us, and we'll be very happy to answer them. Um, I don't know what kind of questions that you have, but please do, and we'll be very happy to answer what questions you have. Okay, I have a question, a couple of questions actually. So the first one is, what is the difference between MSc PH in Penang and the public health programs in UCD Ireland? Well, it's the same. It's exactly the same. That's our, but the one in Penang. Penang is we were known as Penang Medical College, but we are now RCSI and UCD Malaysia branch. So we are literally a branch campus of the Royal College of Surgeons in Ireland and University College Dublin. So the courses, not all, but some of the courses which are run there are being run here. So one of the courses MSc PH. So what exactly the course that is going on there is exactly the same course that is going on here. The course is the same, but the cost is different, as I said. So, but in addition to what goes on in Ireland, because they cater for, I guess, what European needs, we have a bit more practical sessions here to cater for the requirements of a lot of developing countries, as I said, dengue, malaria, leptospirosis, other infectious diseases, outbreak investigations, challenges that we are facing. So these are the aspects that we will be looking at when you are here rather than when you're in Dublin, which I assume they will not be doing that. So the next question is, can I transfer from UCD MSCPH to a program in Penang? I'm not sure what you mean by transfer. Are you already a student in MSc PH, or have you registered with MSc PH UCD? If you have already registered, then you need to ask the administrators in UCD MSc PH whether you can transfer here, because at the moment we do not have this credit transfer as yet. But you may do half the course there and half the course here, providing your director of the course approves, which is Professor Mary Cord. Um, but I'm not very sure. You have to ask your administrators there if you're already registered there. So what is the course duration? We start in September and you end somewhere in August. So it's about 10 to 11 months. Well, your classes actually end somewhere in May, and then you have about 2 months to prepare your dissertation. So end of July you submit your dissertation. By August you should get your results. So it's a 1 year program to be safe. That's of course including your holidays and your semester breaks and so on. Next question, can someone from an arts degree join this program? You need a basic degree. Um, at the moment, it was a bachelor's degree in science with a minimum CGPA of 2.5. But I believe if you would send in your degree and what do you call uh, your results, we will consider case to case basis, because we want to ensure, we are very keen to get people, especially international, but we want to ensure that you will be able to cope with the program. We don't want you to struggle. So if you would send in your qualifications, we will definitely look into it, and we will see how we can work with you. Next question. Any job in opportunity in public health in Canada after masters? As I said, plenty of job opportunities, because the degree that you're getting is actually the National University of Ireland's degree. Plenty of opportunities for you to get jobs. I cannot tell you specifically what jobs are available in Canada. I wouldn't know that. But I'm sure if I was just before the webinar, I was just Googling public health, and I found plenty of jobs everywhere, because there's plenty of opportunities available. I would like to think there will be two groups of people, one who would get the MSc PH and start working, and the other group that will actually proceed with their PhDs, which again makes you even more marketable. Right. Is MSc in public health recognized in Canada? I'm sorry, I cannot tell you, because there's so many countries in the world. You have to find that out from in Canada itself. But I don't see any reason why it is not recognized, because as far as I know, Canada recognizes a lot of degrees from Europe. And I say University College Dublin, under the auspices of National University of Ireland, is a very reputable university, and I don't see a reason why. Unfortunately, I cannot give you an answer. You'll have to check it out with Canada. So I see that's the only questions that you have at the moment, but that doesn't mean that we stop. Please feel free to email us. Thomas, will they have our email address?
Postgraduate, they will send them emails.
They will send you emails, and please do ask any questions that you have. We will try to answer them as soon as possible, as accurately as possible. But the only factor which I like to emphasize is that because a lot of you are international, so we will need at least, there's a minimal time period. I can, for different countries it's a bit different, but it depends on where you're applying from. In some countries it's up to 3 months, sometimes it's 4 weeks to 6 weeks to prepare your student visa and so on and so forth. So if you are interested, please do apply immediately, and then we can start working on the process. so that you can be here on time when the course starts in September. But for those of you who are from Southeast Asia, there are some scholarships, especially from Myanmar, Cambodia, Vietnam, Thailand, not Philippines, sorry, Indonesia. There are opportunities for One Health scholarship. I didn't speak about One Health, but One Health is something that I'm very, very passionate about. One Health is about human, animal, and environment interaction in dealing. I do a lot of work. If you have the time, please go to my department website. That's the Department of Public Health, Penang Medical College website. Sorry, it's a Facebook page. You will see the amount of work that we do, and it's very interesting. We do work with a lot of international universities and international students. Um, it involves animals, elephants, and wildlife, and Aboriginal communities in the Bloom Forest. So those of you all who are those who are a bit active and who love nature, so maybe you'll have an opportunity to do some when you're part of your dissertation with me and out there in the forest. Okay, so we don't have any more questions. So we don't have questions at the moment. As I said, please do send us your inquiries if you have any. And if you are interested, please do get back to us as soon as possible so we can start preparing your immigration visa. We are very excited. We have a group of dynamic lecturers here, and we do get lecturers from Dublin who will come and also help us out. We have online lectures, we have lectures here, we do a bit of field work. So we are all excited, and we hope to see you soon in September and to start your journey through public health with us. And who knows, maybe you will continue with your PhD with us here. Okay, so it was nice talking to you guys. Thank you very much. I'll pass you back to Thomas.
All right, thank you everyone for your kind attention to about half an hour of a presentation. We will be emailing you guys, all the participants who sign up for the webinar. We will email you the details for the course, and also, yeah, from there on, we can actually stay connected. Okay, so thank you very much. This is the end of the session. Right, see you soon.